Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 98 Practice NCLEX Questions. Without the way, let's get started.
A client is admitted to the hospital for evaluation of recurrent episodes of ventricular tachycardia, as observed on Holter monitoring. The client is scheduled for electrophysiologist studies the following morning. Which statement should the nurse include in a teaching plan for this client? 1. You will continue to take your medications until the morning of the test. 2. You might be sedated during the procedure and will not remember what has happened. 3. This test is a non-invasive method of determining the effectiveness of your medication regimen. 4. During the procedure, the doctor will insert a special wire to increase the heart rate and produce the irregular beats that cause your signs and symptoms. The correct answer is 4. The purpose of EPS is to study the heart's electrical system. During this invasive procedure, a special wire is introduced into the heart to produce dysrhythmia. To prepare for this procedure, the client should be NPO for 6 to 8 hours before the test, and all antidysrhythmics are held for at least 24 hours before the test in order to study the dysrhythmia without the influence of medications. Because the client's verbal responses to the rhythm changes are extremely important, sedation is avoided if possible. During physical assessment, the nurse should further assess the client for signs of atrial fibrillation when palpation of the radial pulse reveals 1. 2 regular beats followed by 1 irregular beat. 2. An irregular rhythm with pulse rate greater than 100. 3. Pulse rate below 60 beats per minute. 4. A weak, thready pulse. The correct answer is 2. Characteristics of atrial fibrillation include pulse rate greater than 100 beats per minute, totally irregular rhythm, and no definite P waves on the ECG. During assessment, the nurse is likely to note the irregular rate and should report it to the physician. A weak, thready pulse is characteristic of a client in shock. 2 regular beats followed by an irregular beat may indicate a premature ventricular contraction. When teaching the client about complications of atrial fibrillation, the nurse should instruct the client to avoid which of the following. 1. Stasis of blood in the atria. 2. Increased cardiac output. 3. Decreased pulse rate. 4. Elevated blood pressure. The correct answer is 1. Atrial fibrillation occurs when the sinoatrial node no longer functions as the heart's pacemaker and impulses are initiated at sites within the atria. Because conduction through the atria is disturbed, atrial contractions are reduced and stasis of blood in the atria occurs, predisposing to emboli. Some estimates predict that 30% of clients with atrial fibrillation develop emboli. Atrial fibrillation is not associated with increased cardiac output, elevated blood pressure, or decreased pulse rate. Rather, it is associated with an increased pulse rate. When teaching a client about self-care following placement of a new permanent pacemaker to the left upper chest, the nurse should include which information? Select all that apply. 1. Take and record daily pulse rate. 2. Avoid air travel because of airport security alarms. 3. Immobilize the affected arm for 4 to 6 weeks. 4. Avoid using a microwave oven. 5. Avoid lifting anything heavier than 3 pounds. The correct answers are 1 and 5. The nurse must teach the client how to take and record the pulse daily. The client should be instructed to avoid lifting the operative side arm above shoulder level for 1 week post-insertion. It takes up to 2 months for the incision site to heal and full range of motion to return. The client should avoid heavy lifting until approved by the physician. The pacemaker metal casing does not set off airport security alarms, so there are no travel restrictions. Prolonged immobilization is not required. Microwave ovens are safe to use and do not alter pacemaker function. A client has been admitted to the coronary care unit. The nurse observes third-degree heart block at a rate of 35 beats per minute on the client's cardiac monitor. The client has a blood pressure of 90/60. The nurse should take which of the following actions first? 1. Prepare for transcutaneous pacing. 2. Prepare to defibrillate the client at 200 joules. 3. Administer an IV lidocaine infusion. 4. Schedule the operating room for insertion of a permanent pacemaker. The correct answer is 1. Transcutaneous pacemaker therapy provides an adequate heart rate to a client in an emergency situation. Defibrillation and a lidocaine infusion are not indicated for the treatment of third-degree heart block. Transcutaneous pacing is used temporarily until a transvenous or permanent pacemaker can be inserted. A client is scheduled for the insertion of an implantable cardioverter defibrillator, ICD. The spouse expresses anxiety about what would happen if the device discharges during physical contact. The nurse should tell the spouse, 1. Physical contact should be avoided whenever possible. 2. They will not feel the countershock. 3. The shock will be felt, but it would not cause any harm. 4. A warning device sound before countershock, so there is time to move away. The correct answer is 4. An implanted defibrillator always provides at least 3 beeps before delivering a countershock, and the nurse should tell the spouse to move away when they hear those beeps. The spouse can have physical contact with the client, but if the ICD were to discharge while the spouse had contact with the client, the spouse would feel the shock and could also be harmed. The spouse will feel the countershock if touching the client, and it would harm the spouse. An older adult is admitted to the telemetry unit for placement of a permanent pacemaker because of sinus bradycardia. A priority goal for the client within 24 hours after insertion of a permanent pacemaker is to 1. Maintain skin integrity. 2. Maintain cardiac induction stability. 3. Decrease cardiac output. 4. Increase activity level. The correct answer is 2. Maintaining cardiac induction stability to prevent arrhythmias is a priority immediately after artificial pacemaker implantation. The client should have continuous electrocardiographic monitoring until proper pacemaker functioning is verified. Skin integrity, while important, is not an immediate concern. The pacemaker is used to increase heart rate and cardiac output, not decrease it. The client should limit activity for the first 24 to 48 hours after pacemaker insertion. The client should also restrict movement of the affected extremity for 24 hours. The client, who had a permanent pacemaker implanted 2 days earlier, is being discharged from the hospital. The client understands the discharge plan when the client 1. Selects a low cholesterol diet to control coronary artery disease. 2. States a need for bed rest for 1 week after discharge. 3. Verbalizes safety precautions needed to prevent pacemaker malfunction. 4. Explains signs and symptoms of myocardial infarction. The correct answer is 3. Education is a major component of the discharge plan for a client with an artificial pacemaker. The client with a permanent pacemaker needs to be able to state specific information about safety precautions, such as to refrain from lifting more than 3 pounds or stretching and bending, and to count the pulse once per week that are necessary to maintain proper pacemaker function. The client will not necessarily be placed on a low cholesterol diet. The client should resume activities as he is able and does not need to remain on bed rest. The client should know signs and symptoms of MI, but is not at risk because of the pacemaker. An 85-year-old client is admitted to the emergency department at 8 p.m. with syncope, shortness of breath, and reported palpitations. Pulse is 150, blood pressure is 90/62, oxygen saturation is 92% on room air, and respiration is 22. Client has shortness of breath and states, "My heart is jumping out my chest, and it hurts some. I am having trouble catching my breath. I don't want to faint again." At 8:15 p.m., the nurse places a client on an ECG monitor and identifies the following rhythm. See the picture below. The nurse should do which of the following? Select all that apply. 1. Apply oxygen. 2. Prepare to defibrillate the client. 3. Monitor vital signs. 4. Have the client sign consent for cardioversion as prescribed. 5. Teach the client about warfarin, Coumadin, treatment, and the need for frequent blood testing. 6. Draw blood for a CBC count and thyroid function study. The correct answers are 1, 3, and 4. The client has atrial fibrillation and will have a regular pulse and will commonly be tachycardic, with rapid ventricular responses typically in the 110 to 140 range, but rarely over 150 to 170. The goal of treatment is the restoration of sinus rhythm. With a heart rate greater than 150 and symptoms such as shortness of breath, dizziness and syncope and chest pain, synchronized cardioversion will most likely be the treatment of choice. With more controlled heart rates and more minor signs and symptoms, chemical conversion with drugs such as cardizem and digoxin, prior to other interventions, such as synchronized cardioversion with appropriate anticoagulation, may be attempted. Because of the decreased cardiac output, monitoring is essential. Obtaining consent for cardioversion requires a prescription from a healthcare provider, but with the current heart rate, having cardioversion is a very strong possibility for this client. Defibrillation is used for ventricular fibrillation, not atrial fibrillation. Teaching the client about warfarin will be a possibility, but not an immediate intervention. Clients in continued atrial fibrillation usually require some form of anticoagulation. Drawing labs for CBCs to detect anemia or infection and thyroid function studies to determine thyrotoxicosis, a rare but not to be missed cause, especially in older adults. Serum electrolytes in blood, urea, nitrogen/creatinine, looking for electrolyte disturbances or renal failure, are commonly drawn for determining the cause of the atrial fibrillation, but they are not an immediate action. Upon assessment of third-degree heart block on the monitor, the nurse should first 1. Call a code. 2. Begin cardiopulmonary resuscitation. 3. Have transcutaneous pacing. 4. Prepare for defibrillation. The correct answer is 3. Transcutaneous pads should be placed on a client with third-degree heart block. For a client who is symptomatic, transcutaneous pacing is the treatment of choice. The hemodynamic stability and pulse should be assessed prior to calling a code or initiating CPR. Defibrillation is performed for ventricular fibrillation or ventricular tachycardia with no pulse. The nurse observes a cardiac rhythm. See the image below for a client who is being admitted with a myocardial infarction. What should the nurse do first? 1. Prepare for immediate cardioversion. 2. Begin cardiopulmonary resuscitation. 3. Check for a pulse. 4. Prepare for immediate defibrillation. The correct answer is 3. The nurse should first check the client for the presence of a pulse. The presence of a pulse determines the treatment for ventricular tachycardia. It is also important to assess the client's heart rate and level of consciousness. Cardioversion may be used to treat hemodynamically unstable tachycardias. Assessment of instability is required before cardioversion. It is not appropriate to begin CPR unless the pulse is absent. Defibrillation is used to treat ventricular fibrillation or pulseless ventricular tachycardia. The nurse is preparing the client for cardioversion. The nurse should do which of the following? Select all that apply. 1. Explain the procedure to the client. 2. Place a self-adhesive patch between the skin and the paddles. 3. Place the paddles over the client's clothing. 4. Call clear before discharging the electrical current. 5. Record the delivered energy and the resulting rhythm. The correct answers are 1, 2, 4, and 5. The nurse should first explain the procedure to the client, and then place the patch electrodes per agency procedure. The nurse must make sure to call clear before discharging the electrical current to prevent injury to others who may be helping with the procedure. After the procedure, the nurse must record the amount of electrical current delivered and the resulting rhythm. The paddles are placed on the patch adhered to the client's skin, not over the client's clothing. A client who has been given cardiopulmonary resuscitation is transported by ambulance to the hospital's emergency department, where the admitting nurse quickly assesses the client's condition. The most effective way to determine the effectiveness of CPR is noting whether the 1. Pulse rate is normal. 2. Pupils are reacting to light. 3. Mucous membranes are pink. 4. Systolic blood pressure is at least 80. The correct answer is 2. Pupillary reaction is the best indication of whether oxygenated blood has been reaching the client's brain. Pupils that remain widely dilated and do not react to light probably indicate that serious brain damage has occurred. The pulse rate may be normal, mucous membranes may still be pink, and systolic blood pressure may be 80 or higher, and serious brain damage may still have occurred. A client is given amiodarone in the emergency department for a dysrhythmia. Which of the following indicates the drug is having the desired effect? 1. The ventricular rate is increasing. 2. The absent pulse is now palpable. 3. The number of premature ventricular contractions is decreasing. 4. The fine ventricular fibrillation changes to coarse ventricular fibrillation. The correct answer is 3. Amiodarone is used for the treatment of premature ventricular contractions, ventricular tachycardia with a pulse, atrial fibrillation, and atrial flutter. Amiodarone is not used as initial therapy for a pulseless dysrhythmia. During cardiopulmonary resuscitation, the xiphoid process at the lower end of the sternum should not be compressed when performing cardiac compressions. Which of the following organs will be most likely at risk for laceration by forceful compressions over the xiphoid process? 1. Lung. 2. Liver. 3. Stomach. 4. Diaphragm. The correct answer is 2. Because of its location near the xiphoid process, the liver is the organ most easily damaged from pressure exerted over the xiphoid process. During CPR, the pressure on the victim's chest wall should be sufficient to compress the heart, but not so great as to damage internal organs. Injury may result, however, even when CPR is performed properly. When performing external chest compressions on an adult during cardiopulmonary resuscitation, the rescuer should depress the sternum. 1. 0.5 inch. 2. 1 inch. 3. 1.5 inches. 4. 2 inches. The correct answer is 4. An adult sternum must be depressed 2 inches with each compression to ensure adequate heart compression. If a client is receiving rescue breaths and the chest wall fails to rise, during cardiopulmonary resuscitation, the rescuer should first: 1. Try using a bag mask device. 2. Decrease the rate of compressions. 3. Intubate the client. 4. Reposition the airway. The correct answer is 4. If the chest wall is not rising with rescue breaths, the head should be repositioned first to ensure that the airway is adequately opened. A bag mask device allows for delivery of 100% oxygen, but is difficult to manage. If there is just one rescuer, ideally 2 persons are used to operate the bag mask device, one to maintain the seal and the other to provide the ventilations. Compression should be maintained at 100 per minute. During rescue breathing and cardiopulmonary resuscitation, the victim will exhale by: 1. Normal relaxation of the chest. 2. Gentle pressure of the rescuer's hand on the upper chest. 3. The pressure of cardiac compressions. 4. Turning the head to the side. The correct answer is 1. The exhalation phase of ventilation is a passive activity that occurs during CPR as part of the normal relaxation of the victim's chest. No action by the rescuer is necessary. The rapid response team has been called to manage an unwitnessed cardiac arrest in a client's hospital room. The estimated maximum time a person can be without cardiopulmonary function and still not experience permanent brain damage is: 1. 1 to 2 minutes. 2. 4 to 6 minutes. 3. 8 to 10 minutes. 4. 12 to 15 minutes. The correct answer is 2. After a person is without cardiopulmonary function for 4 to 6 minutes, permanent brain damage is almost certain. To prevent permanent brain damage, it is important to begin CPR promptly after a cardiopulmonary arrest. A nurse is helping a suspected choking victim. The nurse should perform the Heimlich maneuver when the victim: 1. Starts to become cyanotic. 2. Cannot speak due to airway obstruction. 3. Can make only minimal vocal noises. 4. Is coughing vigorously. The correct answer is 2. The Heimlich maneuver should be administered only to a victim who cannot make any sounds due to airway obstruction. If the victim can whisper words or cough, some air exchange is occurring, an emergency medical system should be called instead of attempting the Heimlich maneuver. Cyanosis may accompany or follow choking. However, the Heimlich maneuver should only be initiated when the victim cannot speak. When performing the Heimlich maneuver on a conscious adult victim, the rescuer delivers inward and upward thrusts specifically. 1. Above the umbilicus. 2. At the level of the xiphoid process. 3. Over the victim's mid-abdominal area. 4. Below the xiphoid process and above the umbilicus. The correct answer is 4. The thrust should be delivered below the xiphoid process, but above the umbilicus, to minimize the risk of internal injuries. The monitor technician informs the nurse that the client has started having premature ventricular contractions every other beat, which is a priority in nursing action. 1. Activate the rapid response team. 2. Assess the client's orientation and vital signs. 3. Call the physician. 4. Administer a bolus of lidocaine. The correct answer is 2. The priority action is to assess the client and determine whether the rhythm is life-threatening. More information, including vital signs, should be obtained, and the physician should be quickly notified. A bolus of lidocaine may be prescribed to treat this arrhythmia. This is not a code-type situation unless the client has been determined to be in a life-threatening situation. The nurse is preparing to defibrillate a client on a cardiac monitor who is in ventricular fibrillation. See the photo. The nurse should do which of the following? 1. Move the paddle in the nurse's left hand to the midline. 2. Move the paddle in the nurse's right hand to above the client's nipple. 3. Grasp the handles of the paddles to allow visibility of the black markings on the paddle. 4. After pressing the charge button and calling all clear, push the shock button. The correct answer is 4. The paddles are in the correct position. The nurse can push the shock button to defibrillate the client. The nurse is caring for a client whose condition has been deteriorating. The client becomes unresponsive. The blood pressure is 80/40, and oxygen saturation is 90% on 50% face mask. The nurse should 1. Begin chest compressions. 2. Call the rapid response team. 3. Remove the family from the room. 4. Ventilate the client with a bag mask device. The correct answer is 2. The rapid response team should be called immediately to evaluate and treat the client. There is no indication at this time for manual ventilations or chest compressions. If the family is not interfering in client care, it can be reassuring to the family to see that all possible care is being provided. Which activity would be appropriate? To delegate to an unlicensed personnel for a client diagnosed with a myocardial infarction who is stable. 1. Evaluate the lung sounds. 2. Help the client identify risk factors for coronary artery disease. 3. Provide teaching on a 2-gram sodium diet. 4. Record the intake and output. The correct answer is 4. Unlicensed personnel are able to measure and record intake and output. The nurse is responsible for client teaching, physical assessments, and evaluating the information collected on the client. The nursing assistant reports to the nurse that a client is feeling short of breath. The client's blood pressure was 124/78 2 hours ago with a heart rate of 82. The nursing assistant reports that blood pressure is now 84/44 with a heart rate of 54, and the client stated, "I just don't feel good." Which of the following interventions should the nurse initiate? Select all that apply. 1. Confirm the client's vital signs and complete a quick assessment. 2. Inform the charge nurse of the change in condition and initiate the hospital's rapid/emergency response team. 3. Make a quick check on other assigned clients before spending the amount of time required to take care of this client. 4. Position client in semi-Fowler's position. 5. Stay with the client and reassure the client. 6. Call the physician and report the situation using SBAR format. The correct answers are 1, 2, 4, 5, and 6. The nurse must have assessment data and verify vital signs if necessary in order to determine the action that is required. If there is a significant change in the client's condition, the charge nurse should be notified in order to help the nurse with both this client and the nurse's other assigned clients if necessary. Most acute care facilities have a rapid response team that can also help assess and intervene with basic standing orders if necessary. Positioning the client in semi-Fowlers is a nursing action that may assist in breathing and relieve shortness of breath. It is important for the nurse to reassure the client by staying calm and remaining with the client. The physician must be notified of the change in client's condition. The nurse must have all information available and present it to physician in a concise and accurate manner using SBAR format, including a recommendation for treatment if indicated. The nurse should stay with this client and delegate checking on other assigned clients to the charge nurse or nursing assistant. The nurse is assessing a client with heart failure who is receiving home health care monitoring using electronic devices, including scales, blood pressure monitoring, and structured questions to which the client responds daily on a touchscreen monitor. The nurse reviews data obtained within the last 3 days. The nurse calls the client to follow up. The nurse should ask the client which of the following first. 1. How are you feeling today? 2. Are you having shortness of breath? 3. Did you calibrate the scales before using them? 4. How much fluid did you drink during the last 24 hours? The correct answer is 2. The client has gained 5 pounds in 3 days with a steady increase in blood pressure. The client is exhibiting signs of heart failure, and if the client is short of breath, this will be another sign. Asking how the client is feeling is too general, and a more focused question will quickly determine the client's current health status. The scales should be calibrated periodically, but a 5 pounds weight gain, along with increased blood pressure, is not likely due to problems with the scale. The weight gain is likely due to fluid retention, not drinking too much fluid. The nurse is tracking data on a group of clients with heart failure who have been discharged from the hospital and are being followed at a clinic, which of the following data indicate that nursing interventions of monitoring and teaching have been effective. 1. 90% of clients have not gained weight. 2. 75% of the clients viewed the educational video. 3. 80% of the clients reported that they are taking their medications. 4. 5% of the clients required hospitalization in the last 90 days. The correct answer is 4. The goals of managing clients outside of the hospital are for the clients to maintain health and prevent readmission, thus interventions, such as monitoring and teaching, appear to have contributed to the low readmission rate in this group of clients. Although it is important that clients do not gain weight, view educational material, and continue to take their medication, the primary indicator of effectiveness of the program is the lack of rehospitalization. The nurse in the intensive care unit is giving a report to the nurse in a cardiac step-down unit about a client who had coronary artery bypass surgery. Which of the following is the most effective way to assure essential information about the client is reported? 1. Give a report face-to-face with both nurses in a quiet room. 2. Audio tape the report for future reference and documentation. 3. Use a printed checklist with information individualized for the client. 4. Document essential transfer information in the client's electronic health record. The correct answer is 3. Using an individualized, printed checklist ensures that all key information is reported. The checklist can then serve as a record to which nurses can refer later. Giving a verbal report leaves room for error in memory. Using an audio tape or an electronic health record requires nurses to spend unnecessary time retrieving information. The nurse is planning care for elderly clients who are affected by orthostatic hypotension. The nurse should do which of the following? Select all that apply. 1. Assist the clients to stand to help prevent falls. 2. Teach clients how to gradually change their position. 3. Request a prescription for antihypertensive medications for clients at high risk. 4. Conduct fall risk assessments. 5. Consider the use of sequential compression devices for high-risk clients. 6. Place clients on bed rest. The correct answers are 1, 2, 4, and 5. Orthostatic hypotension is a drop in blood pressure that occurs when changing position, usually to a more upright position. Orthostatic hypotension often occurs in elderly clients, and it is a common cause of falls. Nurses must assess clients for orthostatic hypotension and assist all clients with orthostatic hypotension in standing to help prevent falls. Lower limb compression devices aid in prevention of decreased orthostatic systolic blood pressure and reduce symptoms in elderly clients with progressive orthostatic hypotension. Nurses must teach clients how to gradually change their position, and they must conduct fall risk assessments. Sequential compression devices may be helpful to high-risk clients and should be considered when developing the care plan. Antihypertensive medications are not necessary for clients with orthostatic hypertension and may precipitate dangerous drops in blood pressure. The client should be encouraged to be ambulatory. A client with peripheral vascular disease has chronic, severe pretibial and ankle edema bilaterally. Because the client is on complete bed rest and circulation is compromised, one goal is to maintain tissue integrity. Which of the following interventions will help achieve this outcome? 1. Administering pain medication. 2. Encouraging fluids. 3. Turning the client every 1 to 2 hours. 4. Maintaining hygiene. The correct answer is 3. The client is at greater risk for skin breakdown in the lower extremities related to the edema and to remaining in one position, which increases capillary pressure. Turning the client every 1 to 2 hours promotes vasodilation and prevents vascular compression. Administering pain medication will not have an effect on skin integrity. Encouraging fluids is not a direct intervention for maintaining skin integrity, although being well hydrated is a goal for most clients. Maintaining hygiene does influence skin integrity, but is secondary in this situation. A client who has been diagnosed with peripheral vascular disease is being discharged. The client needs further instruction if she says she will. 1. Avoid heating pads. 2. Not cross the legs. 3. Wear leather shoes. 4. Use iodine on an injured site. The correct answer is 4. The client should avoid using iodine or over-the-counter medications. Iodine is a highly toxic solution. An individual who has known PVD should be seen by a physician for treatment to avoid infection. The client with PVD should avoid heating pads and crossing the legs and should wear leather shoes. A heating pad can cause injury, which, because of the decreased blood supply, can be difficult to heal. Crossing the legs can further impede blood flow. Leather shoes provide better protection. A client with peripheral vascular disease has bypass surgery. The primary goal of the plan of care after surgery is to 1. Maintain circulation. 2. Prevent infection. 3. Relieve pain. 4. Provide education. The correct answer is 1. Maintaining circulation in the affected extremity after surgery is the focus of care. The graft can become occluded, and the client must be assessed frequently to determine whether the graft is patent. Preventing infection and relieving pain are important, but are secondary to maintaining graft patency. Education should have taken place in the preoperative phase, and then continued during the recovery phase. The nurse is instructing a client who is at risk for peripheral vascular disease how to use knee-length elastic stockings. The teaching plan should include which of the following? Select all that apply. 1. Apply the elastic stockings in the morning. 2. Remove the stockings if swelling occurs. 3. Apply the stockings while in bed. 4. Once the stockings have been pulled over the calf, roll the remaining stocking down to make a cuff. 5. Keep the stockings in place for 48 hours and reapply using a clean pair of stockings. The correct answers are 1 and 3. Elastic stockings are used to promote circulation by preventing pooling of blood in the feet and legs. The stocking should be applied in the morning before the client gets out of bed. The stocking should be applied smoothly to avoid wrinkles, but the top should not be rolled down to avoid constriction of circulation. The stockings should be removed every 8 hours, and the client should elevate the legs for 15 minutes and reapply the stockings. Clean stockings should be applied daily or as needed. A client is scheduled to undergo right axillary to axillary artery bypass surgery. Which of the following interventions is most important for the nurse to implement in the preoperative period? 1. Assess the temperature in the affected arm. 2. Monitor the radial pulse in the affected arm. 3. Protect the extremity from cold. 4. Avoid using the arm for a venipuncture. The correct answer is 4. If surgery is scheduled, the nurse should avoid venipunctures in the affected extremity. The goal should be to prevent unnecessary trauma and possible infection in the affected arm. Disruptions in skin integrity and even minor skin irritations can cause the surgery to be canceled. The nurse can continue to monitor the temperature and radial pulse in the affected arm. However, doing so is not the priority. Keeping the client warm is important, but is not the priority at this time. One goal in caring for a client with arterial occlusive disease is to promote vasodilation in the affected extremity. To achieve this goal, the nurse should encourage the client to 1. Avoid eating low-fat foods. 2. Elevate the legs above the heart. 3. Stop smoking. 4. Begin a jogging program. The correct answer is 3. Nicotine causes vasospasm and impedes blood flow. Stopping smoking is the most significant lifestyle change a client can make. The client should eat low-fat foods as part of a balanced diet. The legs should not be elevated above the heart because this will impede arterial flow. The legs should be in a slightly dependent position. Jogging is not necessary and probably is not possible for many clients with arterial occlusive disease. A rehabilitation program that includes daily walking is suggested. The client has aching, weakness, and a cramping sensation in both of the lower extremities while walking. To promote health and maintain the client's level of activity, the nurse should suggest that the client try 1. Cross-country skiing. 2. Jogging. 3. Golfing. 4. Riding a stationary bike. The correct answer is 4. In this case, the exercise prescription needs to be individualized because walking causes discomfort. To maintain the level of activity and decrease venous congestion, riding a stationary bike is another appropriate exercise behavior. Use of a stationary bike provides a non-weight-bearing exercise modality, which allows a longer duration of activity. Jogging and cross-country skiing are weight-bearing activities. In addition, cross-country skiing involves a cold environment, and maintaining warmth is essential in promoting arterial blood flow and preventing vasoconstriction. Golfing is a good activity, but it is not typically considered an exercise that causes aerobic changes in the body. The client with peripheral vascular disease has been prescribed diltiazem. The nurse should determine the effectiveness of this medication by assessing the client for 1. Relief of anxiety. 2. Sedation. 3. Vasoconstriction. 4. Vasodilation. The correct answer is 4. Diltiazem is a calcium channel blocker that blocks the influx of calcium into the cell. In this situation, the primary use of diltiazem is to promote vasodilation and prevent spasms of the arteries. As a result of the vasodilation, blood, oxygen, and nutrients can reach the muscle and tissues. Diltiazem is not an anti-anxiety agent and does not promote sedation. It also does not cause vasoconstriction, which would be contraindicated for a client with peripheral vascular disease. A client is receiving pentoxifylline for intermittent claudication. The nurse should determine the effectiveness of the drug by asking if the client 1. Has improved circulation in the legs. 2. Can wiggle the toes. 3. Is urinating more frequently. 4. Is less dizzy. The correct answer is 1. Although pentoxifylline's precise mechanism of action is unknown, its therapeutic effect is to increase blood flow, and the client should have improved circulation in the legs. The client does not have nerve impairment and should be able to wiggle the toes. Urination is not improved by taking pentoxifylline. Dizziness is a side effect of the drug, not an intended outcome. A client with peripheral vascular disease coronary artery disease, and chronic obstructive pulmonary disease, takes theophylline 200 milligrams twice daily every day, and digoxin 0.5 milligrams once a day. The physician now prescribes pentoxifylline. To prevent problematic adverse effects, the nurse should monitor the clients. 1. Digoxin level. 2. Partial thromboplastin time. 3. Serum cholesterol level. 4. Theophylline level. The correct answer is 4. Pentoxifylline can potentiate the effects of theophylline and increase the risk of theophylline toxicity. Therefore, the nurse should monitor the client's theophylline level. Pentoxifylline does not interact with digoxin. Pentoxifylline can interact with heparin, and the client's PTT would need to be monitored closely if the client were taking heparin. It does not affect cholesterol levels. A client with a history of coronary artery disease has been diagnosed with peripheral vascular disease. The physician started the client on pentoxifylline once daily. Approximately 1 hour after receiving the initial dose of pentoxifylline, the client reports having chest pain. The nurse should first 1. Initiate the rapid response team. 2. Contact the physician. 3. Encourage the client to relax. 4. Document the episode in the chart. The correct answer is 2. Angina is an adverse reaction to pentoxifylline, which should be used cautiously in clients with CAD. The nurse should report the client's symptoms to the physician, who may prescribe nitroglycerin and possibly discontinue the pentoxifylline. The client should rest until the chest pain subsides, and documentation is essential when a client experiences an adverse reaction with medications that have been prescribed. However, the nurse's top priority is to call the physician, report the problem, and obtain a prescription for nitroglycerin. The client's reports of symptoms should never be dismissed. A client with peripheral vascular disease is recovering from an aortofemoral popliteal bypass graft. When developing a postoperative education plan, which question by the nurse will provide the most helpful information? 1. How did you manage your health before admission? 2. How far could you walk without pain before surgery? 3. What is your home environment like? 4. Do you have problems with your retention? The correct answer is 1. Assessing the individual's health behavior before surgery will help the nurse and client develop strategies to manage the postoperative course. Asking open-ended questions will elicit the most helpful information. The client's ability to walk after surgery will be improved after surgery. The nurse can ask direct questions after obtaining general information. The client with peripheral vascular disease and a history of hypertension is to be discharged on a low-fat, low-cholesterol, low-sodium diet, which should be the nurse's first step in planning the dietary instructions. 1. Determine the client's knowledge level about cholesterol. 2. Ask the client to name foods high in fat, cholesterol, and salt. 3. Explain the importance of complying with the diet. 4. Assess the family's food preferences. The correct answer is 4. Before beginning dietary interventions, the nurse must assess the client's pattern of food intake, lifestyle, food preferences, and ethnic, cultural, and financial influences. While the nurse is providing preoperative teaching for a client with peripheral vascular disease who is to have a below-the-knee amputation, the client says, "I hate the idea of being an invalid after they cut off my leg." The nurse's most therapeutic response should be, 1. You'll still have one good leg to use. 2. Tell me more about how you're feeling. 3. Let's finish the preoperative teaching. 4. You're fortunate to have a wife who can take care of you. The correct answer is 2. Encouraging the client who is undergoing amputation to verbalize feelings is the most therapeutic nursing intervention. By eliciting concerns, the nurse may be able to provide information to help the client cope. The nurse should avoid value-laden responses, such as, "You'll still have one good leg," that may make the client feel guilty or hostile and block further communication. The nurse should not ignore the client's expressed concerns, nor should the nurse reinforce the client's concern about invalidism and dependency or assume that his wife is willing to care for him. The client asks the nurse, "Why can't the doctor tell me exactly how much of my leg they're going to take off? Don't you think I should know that?" The nurse responds, knowing that the final decision on the level of the amputation will depend primarily on 1. The need to remove as much of the leg as possible. 2. The adequacy of the blood supply to the tissues. 3. The ease with which a prosthesis can be fitted. 4. The client's ability to walk with a prosthesis. The correct answer is 2. The level of amputation commonly cannot be accurately determined until surgery, when the surgeon can directly assess the adequacy of the circulation of the residual limb. A longer residual limb facilitates prosthesis fitting and will make it easier for the client to walk. However, although these aspects will be considered in the final decision, they are not the primary factors influencing the decision. A client has undergone an amputation of 3 toes and a femoropopliteal bypass. The nurse should teach the client that after surgery, which of the following leg positions is contraindicated while sitting in a chair? 1. Crossing the legs. 2. Elevating the legs. 3. Flexing the ankles. 4. Extending the knees. The correct answer is 1. Leg crossing is contraindicated because it causes adduction of the hips and decreases the flow of blood into the lower extremities. This may result in increased pressure in the graft in the affected leg. Elevating the legs, flexing the ankles, and extending the knees are not necessarily contraindicated. The nurse is monitoring the client after and above the knee amputation and notes that blood has saturated through the distal part of the dressing. The nurse should immediately 1. Apply a tourniquet. 2. Assess vital signs. 3. Call the physician. 4. Elevate the surgical extremity with a large pillow. The correct answer is 2. The client should be evaluated for hemodynamic stability and extent of bleeding prior to calling the physician. Direct pressure can be used prior to applying a tourniquet if there is significant bleeding. To avoid flexion contractures, which can delay rehabilitation, elevation of the surgical limb is contraindicated. The client has had a below-the-knee amputation, secondary to arterial occlusive disease. The nurse is instructing the client in residual limb care, which of the following statements by the client indicates that the client understands how to implement the plan of care. 1. I should inspect the incision carefully when I change the dressing every other day. 2. I should wash the incision, dry it, and apply moisturizing lotion daily. 3. I should rewrap the stump as often as needed. 4. I should elevate the stump on pillows to decrease swelling. The correct answer is 3. The purpose of wrapping the residual limb is to shape the residual limb to accept the prosthesis and bear weight. The compression bandaging should be worn at all times for many weeks after surgery and should be reapplied as needed to keep it free of wrinkles and snug. The dressing should be changed daily to allow for inspection of the stump incision. No lotion should be applied to the stump unless specifically prescribed by the physician. The stump should not be elevated on pillows because this will contribute to the formation of flexion contractures. Contractures will prevent the client from wearing a prosthesis and ambulating. Which of the following clients is at greatest risk for Buerger's disease? 1. A 29-year-old male with a 14-year history of cigarette smoking. 2. A 38-year-old female who is taking birth control pills. 3. A 54-year-old female with adult-onset diabetes. 4. A 65-year-old male with atherosclerosis. The correct answer is 1. Buerger's disease is a non-atherosclerotic, inflammatory vaso-occlusive disorder. The disorder occurs predominantly in younger men, less than 40 years of age, and there is a very strong relationship with tobacco use. Diagnosis is based on age of onset, history of tobacco use, symptoms, and exclusion of diabetes mellitus. The primary goal for the client with Buerger's disease is to prevent 1. Embolus formation. 2. Fat embolus formation. 3. Thrombus formation. 4. Thrombophlebitis. The correct answer is 3. Because of the inflammation, a common complication of Buerger's disease is thrombus formation and potential occlusion of the vessel. Inflammation of the immediate and small arteries and veins is involved in the disease process. Embolus is a potential risk if a thrombus has developed. Fat embolus is associated with fractures of the bones. Thrombophlebitis occurs after thrombus formation. A client with Buerger's disease smokes 2 packs of cigarettes a day. When helping a client change smoking behavior, it is important to know the clients. 1. Ability to attend support groups. 2. Goals for the treatment. 3. Perception of the negative behavior. 4. Motivation. The correct answer is 3. When helping a client change detrimental health behavior, it is critical to learn how the client perceives a situation or problem. The client is more likely to change detrimental health behaviors if he realizes that there's a problem and that these behaviors lead to the problem. While understanding the client's ability to attend group meetings, his goals for treatment, and his motivation may help facilitate change, the nurse should first understand the client's perception of the problem and then determine what strategies might work from his perspective. A client with Buerger's disease has established a goal to stop smoking. Which medication would be the most helpful in attaining this goal? 1. Bupropion. 2. Nicotine. 3. Nitroglycerin. 4. Ibuprofen. The correct answer is 1. Bupropion is used to promote smoking cessation. All types of nicotine should be avoided to prevent vasoconstriction. Nitroglycerin, used for angina, and ibuprofen, an anti-inflammatory medication, have no role in smoking cessation. The nurse is assessing a client with Buerger's disease. The nurse should determine if the client is experiencing 1. Thickening of the intima and media of the artery. 2. Inflammation and fibrosis of arteries, veins, and nerves. 3. Vasospasm lasting several minutes. 4. Pain, pallor, and pulselessness. The correct answer is 2. Buerger's disease is characterized by inflammation and fibrosis of arteries, veins, and nerves. White blood cells infiltrate the area and become fibrotic, which results in occlusion of the vessels. Signs and symptoms include slowly developing claudication, cyanosis, coldness, and pain at rest. Thickening of the intima and media of the artery is characteristic of atherosclerosis. Vasospasm lasting several minutes is characteristic of Raynaud's disease. Pain, pallor, and pulselessness are symptoms of acute occlusion of an artery by an embolus or other cause such as compartment syndrome. When instructing a client who has been newly diagnosed with vasospastic disorder, Raynaud's phenomenon, about management of care, the nurse should discuss which of the following topics. 1. Scheduling a sympathectomy procedure for the next visit. 2. Using a beta blocker medication. 3. Follow-up monitoring for development of connective tissue disease. 4. Benefit of an angioplasty to the affected extremities. The correct answer is 3. Clients with Raynaud's phenomenon should receive routine follow-up to monitor symptoms and to assess the development of connective tissue or autoimmune diseases associated with Raynaud's. Beta blockers are not considered first-line drug therapy. A sympathectomy is considered only in advanced cases. There is no benefit to an angioplasty, which is used for atherosclerotic vascular disease. A client has been diagnosed with vasospastic disorder, Raynaud's phenomenon, on the tip of the nose and fingertips. The physician has prescribed reserpine to determine if the client will obtain relief. The client often works outside in cold weather and also smokes 2 packs of cigarettes per day. Which of the following should be included in the discharge plan for this client? Select all that apply. 1. Stopping smoking. 2. Wearing a face covering and gloves in the winter. 3. Placing fingertips in cool water to rewarm them. 4. Finding employment that can be done in a warm environment. 5. Reporting signs of orthostatic hypotension. The correct answers are 1, 2, and 5. Vasospastic disorder, Raynaud's disease, is a form of intermittent arteriolar vasoconstriction that results in coldness, pain, and pallor of the fingertips, toes, or tip of the nose, and a rebound circulation with redness and pain. The nurse should instruct the client to stop smoking because nicotine is a vasoconstrictor. An adverse effect of reserpine is orthostatic hypotension. The client should report dizziness and low blood pressure, as it may be necessary to consider stopping the drug. The client should prevent vasoconstriction by covering affected parts when in cold environments. The nurse can teach the client to rewarm exposed extremities by using warm water or placing them next to the body, such as under the axilla. It is not realistic to ask this client to change jobs at this time. A nurse assesses a 40-year-old female client with vasospastic disorder, Raynaud's phenomenon, involving her right hand. The nurse notes the information in the progress notes. The notes say, the client has a palpable but faint right radial pulse. Capillary refill on 5 digits is less than 8 seconds. No observable swelling. The client is reporting numbness in the tips of all digits. The skin is warm, dry, and red. From these findings, the nurse should develop a plan with the client to first manage. 1. Acute pain. 2. Numbness. 3. Lack of circulation. 4. Potential for skin breakdown. The correct answer is 2. The client has numbness in the fingertips, and the nurse should first help the client regain sensory perception and discuss strategies for prevention of injury. The client does not have acute pain. The client does have adequate circulation and is not at risk for skin breakdown at this time. Which of the following clients is at greatest risk for vasospastic disorder, Raynaud's phenomenon? 1. Young women. 2. Old women. 3. Old men. 4. Young men. The correct answer is 1. Vasospastic disorder, Raynaud's disease, is more common in young women and is associated with collagen diseases such as rheumatoid arthritis and lupus. The client with vasospastic disorder, Raynaud's phenomenon, has coldness and numbness in the fingers. The nurse assesses the client for effects of vasoconstriction. Which of the following is an early sign of vasoconstriction? 1. Cyanosis. 2. Gangrene. 3. Pallor. 4. Rubor. The correct answer is 3. Initially, the vasoconstriction effect produces pallor or a whitish coloring, followed by cyanosis and finally rubor. Gangrene is the end result of complete arterial occlusion. The skin is blackened and without a blood supply. During an initial assessment of a client diagnosed with vasospastic disorder, Raynaud's phenomenon, the nurse notes a sudden color change from pink to white in the fingers. The nurse should first assess 1. Appearance of cyanosis. 2. Radial pulse. 3. Oxygen saturation of the affected fingers. 4. Blood pressure. The correct answer is 2. Decreased perfusion from vasospasm induces color changes in the extremity. The degree of decreased perfusion should be assessed by taking the radial pulse. Color changes progressively to blue with cyanosis and then red when reperfusion occurs. The oxygen saturation requires adequate perfusion for accuracy. A blood pressure will cause further constriction and reduction of perfusion in the extremity. The nurse should instruct a client who has been diagnosed with vasospastic disorder, Raynaud's phenomenon, to 1. Immerse the hands in cold water during an episode. 2. Wear light garments when the temperature gets below 50 degrees Fahrenheit. 3. Wear gloves when handling ice or frozen foods. 4. Live in a cold climate. The correct answer is 3. Extreme changes in temperature can precipitate a vasospastic episode and should be avoided by clients with vasospastic disorder, Raynaud's disease. The client should be encouraged to wear gloves when handling frozen foods or ice. The client should immerse the involved extremity in warm water during an episode to promote vasodilation and relaxation of the small arteries that are in spasm. The client can help prevent vasospasm brought on by temperature changes by wearing warm clothes. Living in a cold climate will exacerbate the symptoms. In order to prevent recurrent vasospastic episodes with Raynaud's phenomenon, the nurse should instruct the client to 1. Keep the hands and feet elevated as much as possible. 2. Use a vibrating massage device on the hands. 3. Wear gloves when obtaining food from the refrigerator. 4. Increase coffee intake to 2 cups per day. The correct answer is 3. Loose, warm clothing should be worn to protect from the cold. Wearing gloves when handling cold objects will help prevent vasospasms. Vibrating equipment and typing contribute to vasospasm. Tobacco and caffeine should be avoided. Elevation will decrease arterial perfusion during vasospasms. A client with Raynaud's phenomenon is prescribed diltiazem. An expected outcome is 1. Decreased heart rate. 2. Conversion to normal sinus rhythm. 3. Reduced episodes of finger numbness. 4. Increased SpO2. The correct answer is 3. Calcium channel blockers are first-line drug therapy for the treatment of vasospasms with Raynaud's phenomenon when other therapies are ineffective. Cardizem relaxes smooth muscles and improves peripheral perfusion, therefore reducing finger numbness. Cardizem decreases heart rate and is used to treat atrial fibrillation, but these are not associated with Raynaud's. When vasospasms are prevented, an accurate SpO2 can be measured in the affected extremity. However, SpO2 is a measurement of systemic oxygenation not influenced by cardizem. When giving discharge instructions to the client with vasospastic disorder, Raynaud's phenomenon, the nurse should explain that the expected outcome of taking a beta-adrenergic blocking medication is to control the symptoms by 1. Decreasing the influence of the sympathetic nervous system on the tissues in the hands and feet. 2. Decreasing the pain by producing analgesia. 3. Increasing the blood supply to the affected area. 4. Increasing monoamine oxidase. The correct answer is 1. Beta-adrenergic medications block the beta-adrenergic receptors. Therefore, the expected outcome of the medication is to decrease the influence of the sympathetic nervous system on the blood vessels in the hands. Beta-adrenergic blockers have no analgesic effects. Increasing blood supply to the affected area is an indirect effect of beta-adrenergic blockers. They do not increase monoamine oxidase, which does not play a role in Raynaud's disease. A client with vasospastic disorder, Raynaud's phenomenon, is considering having a sympathectomy. This nurse should tell the client that the surgery is performed 1. In the early stages of the disease to prevent further circulatory disturbances. 2. When the disease is controlled by medication. 3. When the client is unable to control stress-related vasospasm. 4. When all other treatment alternatives have failed. The correct answer is 4. Sympathectomy is scheduled only after other treatment alternatives have been explored and have failed. Medication and stress management are beneficial strategies to prevent advancement of the disease process. If the disease is controlled by medication, there is no reason for surgery. A client with pernicious anemia asks why it is necessary to take vitamin B12 injections forever. Which is the nurse's best response? 1. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient acid. 2. The reason for your vitamin deficiency is an inability to absorb the vitamin because the stomach is not producing sufficient intrinsic factor. 3. The reason for your vitamin deficiency is an excessive excretion of the vitamin because of kidney dysfunction. 4. The reason for your vitamin deficiency is an increased requirement for the vitamin because of rapid red blood cell production. The correct answer is 2. Most clients with pernicious anemia have deficient production of intrinsic factor in the stomach. Intrinsic factor attaches to the vitamin in the stomach and forms a complex that allows the vitamin to be absorbed in the small intestine. The stomach is producing enough acid. There is not an excessive excretion of the vitamin, and there is not a rapid production of red blood cells in this condition. A woman of African descent had experienced severe palpitations, weakness, and shortness of breath after taking bacitracin. As a part of the discharge planning, the nurse should evaluate the client's knowledge about 1. Increased folic acid needs. 2. Congenital enzyme deficiency. 3. Restricted activity in hot weather. 4. Need for blood transfusions. The correct answer is 2. This client presented with the typical signs of glucose 6-phosphate dehydrogenase, aka G6PD, deficiency anemia. 10% of blacks inherit an X-linked recessive disorder of the G6PD enzyme in the red blood cell. When cells with decreased levels of G6PD are exposed to certain drugs, such as sulfonamides, acetylsalicylic acid, thiazide diuretics, and vitamin K, the RBC may hemolyze and anemia and jaundice may occur. The reaction is self-limited as soon as the causative agent is withheld. No further treatment is necessary except counseling to prevent acute incidents by avoiding exposure to specific drugs. There is no need for increased folic acid, restricted activity in hot weather, or blood transfusions. The nurse is assessing a client's activity tolerance by having the client walk on a treadmill for 5 minutes. Which of the following indicates an abnormal response? 1. Pulse rate increased by 20 beats per minute immediately after the activity. 2. Respiratory rate decreased by 5 breaths per minute. 3. Diastolic blood pressure increased by 7. 4. Pulse rate within 6 beats per minute of resting pulse after 3 minutes of rest. The correct answer is 2. The normal physiologic response activity is an increased metabolic rate over the resting basal rate. The decrease in respiratory rate indicates that the client is not strong enough to complete the mechanical cycle of respiration needed for gas exchange. The post-activity pulse is expected to increase immediately after activity, but by no more than 50 beats per minute if it is strenuous activity. The diastolic blood pressure is expected to rise, but by no more than 15. The pulse returns to within 6 beats per minute of the resting pulse after 3 minutes of rest. In a postoperative client, the hematocrit decreased from 36% to 34% on the 3rd day, even though the red blood cell count and hemoglobin value remained stable at 4.5 millions per microliter and 11.9 grams per deciliter, respectively. The nurse should next: 1. Check the dressing and drains for frank bleeding. 2. Call the physician. 3. Continue to monitor vital signs. 4. Start oxygen at 2 liters per minute per nasal cannula. The correct answer is 3. The nurse should continue to monitor the client because this value reflects a normal physiologic response. The physician does not need to be called, and oxygen does not need to be started based on these laboratory findings. Immediately after surgery, the client's hematocrit reflects a falsely high value related to the body's compensatory response to the stress of sudden loss of fluids and blood. Activation of the intrinsic pathway and the renin-angiotensin cycle via antidiuretic hormone produces vasoconstriction and retention of fluid for first 1 to 2 days post-operatively. By the 2nd to 3rd day, this response decreases, and the client's hematocrit level is more reflective of the amount of RBCs in the plasma. Fresh bleeding is a less likely occurrence on the 3rd postoperative day, but is not impossible. However, the nurse should have expected to see a decrease in the RBC count and hemoglobin value accompanying the hematocrit. The nurse is administering packed red blood cells to a client. The nurse should first: 1. Discontinue the IV catheter if a blood transfusion reaction occurs. 2. Administer the PRBCs through a percutaneously inserted central catheter line with a 20-gauge needle. 3. Flush PRBCs with 5% dextrose and 0.45% normal saline solution. 4. Stay with the client during the first 15 minutes of infusion. The correct answer is 4. The most likely time for a blood transfusion reaction to occur is during the first 15 minutes or first 50 milliliters of the infusion. If a blood transfusion reaction does occur, it is imperative to keep an established IV line so that medication can be administered to prevent or treat cardiovascular collapse in case of anaphylaxis. PRBC should be administered through a 19-gauge or larger needle. A peripherally inserted central catheter line is not recommended in order to avoid a slow flow. RBCs will hemolyze in dextrose or lactated ringer solution and should be infused with only normal saline solution. The nurse should instruct a young female adult with sickle cell anemia to do which of the following? Select all that apply. 1. Drink plenty of fluids when outside in hot weather. 2. Avoid being in high altitudes. 3. Be aware that since she is homozygous for hemoglobin S, she carries the sickle cell trait. 4. Know that pregnancy with sickle cell disease increases the risk of a crisis. 5. Avoid flying on commercial airlines. The correct answers are 1, 2, and 4. The nurse should teach the client to drink plenty of fluids to avoid becoming dehydrated. The client should avoid being in high altitudes, such as mountains above 5,000 feet, where there is less oxygen in the air, which may precipitate a sickle cell crisis. The nurse should alert young women with sickle cell anemia that pregnancy increases the risk of a crisis. People who are homozygous for hemoglobin S have sickle cell anemia. The heterozygous form is a sickle cell carrier trait. A client with sickle cell anemia may fly on commercial airlines. The airplane is pressurized and has an adequate oxygen level. The nurse is teaching a client and his family about the client's new diagnosis of hemochromatosis. Which of the following details should the nurse include? 1. Hemochromatosis is an autoimmune disorder that affects the HFE gene. 2. Individuals who are heterozygous for hemochromatosis rarely develop the disease. 3. Individuals who are homozygous for hemochromatosis are carriers of hemochromatosis. 4. Men are at greater risk for hemochromatosis. The correct answer is 2. The nurse should teach the client and family that individuals who are heterozygous for hemochromatosis rarely develop the disease. Men and women are equally at risk for hemochromatosis, but men are diagnosed earlier because women do not usually have manifestations until menopause. Hemochromatosis is the most common genetic disorder in Canada and the United States. Individuals who are homozygous for hemochromatosis receive a defective gene from each parent. Those with homozygous genes may develop the disease. A client is having a blood transfusion reaction. The nurse must do the following in what order priority from first to last? 1. Notify the attending physician and blood bank. 2. Complete the appropriate transfusion reaction forms. 3. Stop the transfusion. 4. Keep the IV open with normal saline infusion. The correct order is 3, 4, 1, and 2. When the client is having a blood transfusion reaction, the nurse should first stop the transfusion and then keep the IV open with normal saline infusion. Next, the nurse should notify the physician and blood bank, then complete the required forms regarding the transfusion reaction. Which safety measures will be most important to implement when caring for a client who is receiving 2 units of packed red blood cells? Select all that apply. 1. Verify that the ABO and RH of the 2 units are the same. 2. Infuse a unit of PRBCs in less than 4 hours. 3. Stop the transfusion if a reaction occurs, but keep the line open. 4. Take vital signs every 15 minutes while the unit is transfusing. 5. Inspect the blood bag for leaks, abnormal color, and clots. 6. Use a 22-gauge catheter for optimal flow of a blood transfusion. The correct answers are 2, 3, and 5. The American Association of Blood Banks and Canadian Blood Services recommend that 2 qualified people, such as 2 licensed nurses, compare the name and number on the identification bracelet with the tag on the blood bag. Verifying that the 2 units are the same is not a recommendation. Rather, the verification is always with the client, not with bags of blood. A unit of blood should infuse in 4 hours or less to avoid the risk of septicemia, since no preservatives are used. When a blood transfusion reaction occurs, the blood transfusion should be stopped immediately, but the 4 lines should be kept open so that emergency medications and fluids can be administered. The unit of PRBC should be inspected for contamination by looking for leaks, abnormal color, clots, and excessive air bubbles. When a unit of PRBCs is being transfused, vital signs are assessed before the transfusion begins, after the first 15 minutes, and then every hour until 1 hour after the transfusion has been completed. When PRBCs are being administered, a 20-gauge or larger needle is needed to avoid destroying the red blood cells passing through the lumen and to allow for maximal flow rate. A client who had received 25 milliliters of packed red blood cells has low back pain and pruritus after stopping the infusion. The nurse should take what action next? 1. Administer prescribed antihistamine and aspirin. 2. Collect blood and urine samples and send to the lab. 3. Administer prescribed diuretics. 4. Administer prescribed vasopressors. The correct answer is 2. ABO and Rh incompatible blood causes an antigen-antibody reaction that produces hemolysis or agglutination of red blood cells. At the first indication of any sign/symptom of reaction, the blood transfusion is stopped. Blood and urine samples are obtained from a client and sent to the lab along with the remaining untransfused blood. Hemoglobin in the urine and blood samples taken at the time of the reaction provide evidence of a hemolytic blood transfusion reaction. Antihistamine, aspirin, diuretics, and vasopressors may be administered with different types of transfusion reactions. A client is to receive EPOIN injections. What laboratory value should the nurse assess before giving an injection? 1. Hematocrit. 2. Partial thromboplastin time. 3. Hemoglobin concentration. 4. Prothrombin time. The correct answer is 1. EPOIN is a recombinant DNA form of erythropoietin, which stimulates the production of red blood cells and therefore causes the hematocrit to rise. The elevation in hematocrit causes an elevation in the blood pressure. Therefore, the blood pressure is a vital sign that should be checked. The partial thromboplastin time, hemoglobin level, and prothrombin time are not monitored for this drug. When beginning IV erythropoietin therapy, the nurse should do which of the following? Select all that apply. 1. Check the hemoglobin levels before administering subsequent doses. 2. Shake the vial thoroughly to mix the concentrated white, milky solution. 3. Keep the multi-dose vial refrigerated between scheduled twice-a-day doses. 4. Administer medication through the IV line without other medications. 5. Adjust the initial doses according to the client's changes in blood pressure. 6. Instruct the client to avoid driving and performing hazardous activity during the initial treatment. The correct answers are 4, 5, and 6. Erythropoietin is administered to decrease the need for blood transfusions by stimulating red blood cell production. The medication should be administered through the IV line without other medications to avoid a reaction. The hematocrit, a simple measurement of the percentage of RBCs in the total blood volume, is used to monitor this therapy. When initiating IV erythropoietin therapy, the nurse should monitor the hematocrit level so that it rises no more than 4 points in any 2-week period. In addition, the initial doses of erythropoietin are adjusted according to the client's changes in blood pressure. The nurse should tell the client to avoid driving and performing hazardous activity during the initial treatment due to possible dizziness and headaches secondary to the adverse effect of hypertension. The hematocrit, not the hemoglobin level, is used for monitoring the effectiveness of therapy. The vial of erythropoietin should not be shaken because it may be biologically inactive. The solution should not be used if it is discolored. The nurse should not re-enter the vial once it has been entered. It is a one-time use vial. All remaining erythropoietin should be discarded since it does not contain preservatives. A client is afraid of receiving vitamin B12 injections because of potential toxic reactions. Which is the nurse's best response to relieve these fears? 1. Vitamin B12 will cause ringing in the ears before a toxic level is reached. 2. Vitamin B12 may cause a very mild rash initially. 3. Vitamin B12 causes mild nausea, but nothing toxic. 4. Vitamin B12 is generally free of toxicity because it is water-soluble. The correct answer is 4. Vitamin B12 is a water-soluble vitamin. When water-soluble vitamins are taken in excess of the body's needs, they are filtered through the kidneys and excreted. Vitamin B12 is considered to be non-toxic. Adverse reactions that have occurred are believed to be related to impurities or to preservative in B12 preparations. Ringing in the ears, rash, and nausea are not considered to be related to vitamin B12 administration. A client with microcytic anemia is having trouble selecting food from the hospital menu. Which food is best for the nurse to suggest for satisfying the client's nutritional needs? 1. Egg yolks. 2. Brown rice. 3. Vegetables. 4. Tea. The correct answer is 2. Brown rice is a source of iron from plant sources. Other sources of non-heme iron are whole grain cereals and breads, dark green vegetables, legumes, nuts, dried fruits, oatmeal, and sweet potatoes. Egg yolks have iron, but it is not as well absorbed as iron from other sources. Vegetables are a good source of vitamins that may facilitate iron absorption. Tea contains tannin, which combines with non-heme iron, preventing its absorption. A client with macrocytic anemia has a burn on the foot and reports watching television while lying on a heating pad. Which action should be the nurse's first response? 1. Assess for potential abuse. 2. Check for diminished sensations. 3. Document the findings. 4. Clean and dress the area. The correct answer is 2. Macrocytic anemias can result from deficiencies in vitamin B12 or ascorbic acid. Only vitamin B12 deficiency causes diminished sensations of peripheral nerve endings. The nurse should assess for peripheral neuropathy and instruct the client in self-care activities for diminished sensation to heat and pain. The burn could be related to abuse, but this conclusion would require more supporting data. The findings should be documented, but the nurse will want to address the client's sensations first. The decision of how to treat the burn should be determined by the physician. Which of the following is a late symptom of polycythemia vera? 1. Headache. 2. Dizziness. 3. Pruritus. 4. Shortness of breath. The correct answer is 3. Pruritus is a late symptom that results from abnormal histamine metabolism. Headache and dizziness are early symptoms from engorged veins. Shortness of breath is an early symptom from congested mucous membranes and ineffective gas exchange. The nurse is teaching a client with polycythemia vera about potential complications from this disease. Which manifestations should the nurse include in the client's teaching plan? Select all that apply. 1. Hearing loss. 2. Visual disturbance. 3. Headache. 4. Orthopnea. 5. Gout. 6. Weight loss. The correct answers are 2, 3, 4, and 5. Polycythemia vera, a condition in which too many red blood cells are produced in the blood serum, can lead to an increase in the hematocrit and hypervolemia, hyperviscosity, and hypertension. Subsequently, the client can experience dizziness, tinnitus, visual disturbances, headaches, or feeling of fullness in the head. The client may also experience cardiovascular symptoms, such as heart failure, and increased clotting time or symptoms of an increased uric acid level, such as painful, swollen joints. Hearing loss and weight loss are not manifestations associated with polycythemia vera. When a client is diagnosed with aplastic anemia, the nurse should assess the client for changes in which of the following physiologic functions. 1. Bleeding tendencies. 2. Intake and output. 3. Peripheral sensation. 4. Bowel function. The correct answer is 1. Aplastic anemia decreases the bone marrow production of red blood cells, white blood cells, and platelets. The client is at risk for bruising and bleeding tendencies. A change in the client's intake and output is important, but assessment for the potential for bleeding takes priority. Change in the peripheral nervous system is a priority problem specific to clients with vitamin B12 deficiency. Change in bowel function is not associated with aplastic anemia. Metoprolol is added to the pharmacologic therapy of a diabetic female diagnosed with stage 2 hypertension, initially treated with furosemide and ramipril. An expected therapeutic effect is 1. Decrease in heart rate. 2. Lessening of fatigue. 3. Improvement in blood sugar levels. 4. Increase in urine output. The correct answer is 1. The effect of a beta blocker is a decrease in heart rate, contractility, and afterload, which leads to a decrease in blood pressure. The client at first may have an increase in fatigue when starting the beta blocker. The mechanism of action does not improve blood sugar or urine output. A client is taking clonidine for treatment of hypertension. The nurse should teach the client about which of the following common adverse effects of this drug. Select all that apply. 1. Dry mouth. 2. Hyperkalemia. 3. Impotence. 4. pancreatitis. 5. Sleep disturbance. The correct answers are 1, 3, and 5. Clonidine is a central-acting adrenergic antagonist. It reduces sympathetic outflow from the central nervous system. Dry mouth impotence and sleep disturbances are possible adverse effects. Hyperkalemia and pancreatitis are not anticipated with use of this drug. A client with hypertensive emergency is being treated with sodium nitroprusside, nipride, in a dilution of 50 milligrams per 250 milliliters. How many micrograms of nipride are in each milliliter? Blank micrograms. The correct answer is 200 micrograms. First, calculate the number of milligrams per milliliter. You do this by dividing 50 by 250, which equals to 0.2 milligrams. So it's 0.2 milligrams per 1 milliliter. 1 milligram equals to 1,000 micrograms. So you multiply 0.2 milligrams by 1,000, which equals to 200 micrograms. The nurse is discussing medications with a client with hypertension who has a prescription for furosemide daily. The client needs further education when the client states which of the following? 1. I know I should not drive after taking my Lasix. 2. I should be careful not to stand up too quickly when taking Lasix. 3. I should take the Lasix in the morning instead of before bed. 4. I need to be sure to also take the potassium supplement that the doctor prescribed along with my Lasix. The correct answer is 1. Furosemide is a diuretic often prescribed for clients with hypertension or heart failure. The drug should not affect a client's ability to drive safely. Lasix may cause orthostatic hypotension, and clients should be instructed to be careful when changing from supine to sitting to standing position. Diuretics should be taken in the morning if possible to prevent sleep disturbance due to the need to get up to void. Lasix is a loop diuretic that is not potassium sparing. Clients should take potassium supplements as prescribed and have their serum potassium levels checked at prescribed intervals. In teaching the client with hypertension to avoid orthostatic hypotension, the nurse should emphasize which of the following instructions? Select all that apply. 1. Plan regular times for taking medications. 2. Arise slowly from bed. 3. Avoid standing still for long periods. 4. Avoid excessive alcohol intake. 5. Avoid hot baths. The correct answers are 2 and 3. Changing positions slowly and avoiding long periods of standing may limit the occurrence of orthostatic hypotension. Scheduling regular medication times is important for blood pressure management, but this aspect is not related to the development of orthostatic hypotension. Excessive alcohol intake and hot baths are associated with vasodilation. The nurse is teaching a client with hypertension about taking atenolol. The nurse should instruct the client to 1. Avoid sudden discontinuation of the drug. 2. Monitor the blood pressure annually. 3. Follow a 2-gram sodium diet. 4. Discontinue the medication if severe headaches develop. The correct answer is 1. Atenolol is a beta-adrenergic antagonist indicated for management of hypertension. Sudden discontinuation of this drug is dangerous because it may exacerbate symptoms. The medication should not be discontinued without a physician's prescription. Blood pressure needs to be monitored more frequently than annually in a client who is newly diagnosed and treated for hypertension. Clients are not usually placed on a 2-gram sodium diet for hypertension. The nurse teaches a client who has recently been diagnosed with hypertension about following a low-calorie, low-fat, low-sodium diet. Which of the following menu selections would best meet the client's needs? 1. Mix green salad with blue cheese dressing, crackers, and cold cuts. 2. Ham sandwich on rye bread and an orange. 3. Baked chicken, an apple, and a slice of white bread. 4. Hot dogs, baked beans, and celery and carrot sticks. The correct answer is 3. Processed and cured meat products, such as cold cuts, ham, and hot dogs, are all high in both fat and sodium and should be avoided on a low-calorie, low-fat, low-salt diet. Dietary restrictions of all types are complex and difficult to implement with clients who are basically asymptomatic. A client who has diabetes is taking metoprolol for hypertension. Which of the following information should the nurse include in the teaching plan? Select all that apply. 1. These tablets should be taken with food at same time each day. 2. Do not crush or chew the tablets. 3. Notify the healthcare provider if pulse is 82 beats per minute. 4. Have a blood glucose level drawn every 6 to 12 months during therapy. 5. Use an appropriate decongestant if needed. 6. Report any fainting spells to the healthcare provider. The correct answers are 1, 2, 4, and 6. Metoprolol is a beta-adrenergic blocker indicated for hypertension, angina, and myocardial infarction. The tablet should be taken with food at same time each day. They should not be chewed or crushed. The healthcare provider should be notified if pulse falls below 50 for several days. Blood glucose should be checked regularly during therapy, since increased episodes of hypoglycemia may occur. It may mask evidence of hypoglycemia, such as palpitations, tachycardia, and tremor. Use of any OTC decongestants, asthma and cold remedies, and herbal preparations must be avoided. Fainting spells may occur due to exercise or stress, and the dosage of the drug may need to be reduced or discontinued. An older adult with a history of hypertension is admitted with diagnosis of dehydration. The client is becoming increasingly confused and weak. The client reports taking 1 tablet of hydrochlorothiazide daily, and the prescription is written for 1/2 tablet. The nurse should obtain additional information about 1. Decreased drug half-life of the hydrochlorothiazide. 2. Decreased hepatic blood flow. 3. Increased GI activity. 4. Increase urinary elimination. The correct answer is 2. Aging causes decreased hepatic blood flow. Decreased drug metabolism, which occurs with aging, along with more drug in circulation, means the drug will remain in the body longer and produce greater drug effects. The client has also taken more drug than prescribed, increasing the opportunity for more drug action to occur. When there is decreased metabolism of drugs, an increase in the half-life will occur most especially in the older adult. In older adults, transit time is slower, allowing more drug to be absorbed. Increased urinary elimination would mean that drug elimination could be higher, not lower, and accumulating in the body. A client diagnosed with primary hypertension is taking chlorothiazide. The nurse determines teaching about this medication is effective when the client makes the following statement. Select all that apply. 1. I will take my weight daily at the same time each day. 2. I will not drink alcoholic beverages while on this medication. 3. I will reduce salt intake in my diet. 4. I will reduce my dosage if I have severe dizziness. 5. I will use sunscreen if I have prolonged exposure to sunlight. 6. Take the drug late in the evening. The correct answers are 1, 2, 3, and 5. Chlorothiazide causes increased urination and decreased swelling and weight loss. It is important to check and record weight 2 to 3 times per week at same time of day with similar amount of clothing. Clients should not drink alcoholic beverages or take other medications without the approval of the healthcare provider. Reducing sodium intake in the diet helps diuretic drugs to be more effective and allows smaller doses to be taken. Smaller doses are less likely to cause adverse effects, and hence excessive table salt, as well as salty food, should be avoided. Chlorothiazide is a diuretic that is prescribed for lower blood pressure and may cause dizziness and faintness when the patient stands up suddenly. This can be prevented or decreased by changing positions slowly. If dizziness is severe, the healthcare provider must be notified. Diuretics may cause sensitivity to sunlight, hence the need to avoid prolonged exposure to sunlight, use sunscreens, and wear protective clothing. Chlorothiazide causes increased urination and must be taken early in the day to decrease nighttime trips to the bathroom. Fewer bathroom trips mean less interference with sleep and less risk of falls. Which intervention would be most likely to assist a client with hypertension in maintaining an exercise program? 1. Giving the client a written exercise program. 2. explaining the exercise program to the client's spouse. 3. Reassuring the client that he or she can do the exercise program. 4. Tailoring a program to the client's needs and abilities. The correct answer is 4. Tailoring or individualizing a program to the client's lifestyle has been shown to be an effective strategy for changing health behaviors. Providing a written program, explaining the program to the client's spouse, and reassuring the client that he or she can do the program may be helpful, but are not as likely to promote adherence as individualizing the program. The client realizes the importance of quitting smoking, and the nurse develops a plan to help the client achieve this goal. Which of the following nursing interventions should be the initial step in this plan? 1. Review the negative effects of smoking on the body. 2. Discuss the effect of passive smoking on environmental pollution. 3. Establish the client's daily smoking pattern. 4. Explain how smoking worsens high blood pressure. The correct answer is 3. A plan to reduce or stop smoking begins with establishing the client's personal daily smoking pattern and activities associated with smoking. It is important that the client understands the associated health and environmental risks, but this knowledge has not been shown to help clients change their smoking behavior. When teaching a client about propranolol hydrochloride, the nurse should base the information on the knowledge that propranolol, 1. blocks beta-adrenergic stimulation, and thus causes decreased heart rate, myocardial contractility, and conduction. 2. Increases norepinephrine secretion, and thus decreases blood pressure and heart rate. 3. Is a potent arterial and venous vasodilator that reduces peripheral vascular resistance and lowers blood pressure. 4. Is an angiotensin-converting enzyme inhibitor that reduces blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2. The correct answer is 1. Propranolol is a beta-adrenergic blocking agent. Actions of propranolol include reducing heart rate, decreasing myocardial contractility, and slowing conduction. Propranolol does not increase norepinephrine secretion, cause vasodilation, or block conversion of angiotensin 1 to angiotensin 2. The client has had hypertension for 20 years. The nurse should assess the client for 1. Renal insufficiency and failure. 2. Valvular heart disease. 3. Endocarditis. 4. Peptic ulcer disease. The correct answer is 1. Renal disease, including renal insufficiency and failure, is a complication of hypertension. Effective treatment of hypertension assists in preventing this complication. Valvular heart disease, endocarditis, and peptic ulcer disease are not complications of hypertension. The nurse is developing a care plan with an older adult with hypertension and is instructing the client that hypertension can be a silent killer. The nurse should instruct the client to report signs of which of the following diseases that are often a result of undetected high blood pressure. 1. Cerebrovascular accidents. 2. Liver disease. 3. Myocardial infarction. 4. Pulmonary disease. The correct answer is 1. Hypertension is referred to as a silent killer for adults because until the adult has significant damage to other systems, the hypertension may go undetected. CVAs can be related to long-term hypertension. Liver or pulmonary disease is not generally associated with hypertension. Myocardial infarction is generally related to coronary artery disease. A hospitalized client who is being treated for hypertension with furosemide, atenolol, and ramipril develops a second-degree heart block Mobitz type 1. Which of the following actions should the nurse take? 1. Administer a 250 milliliters fluid bolus. 2. Withhold atenolol. 3. Prepare for cardioversion. 4. Set up for an arterial line. The correct answer is 2. The client may be asymptomatic and the underlying cause should be assessed. Drugs that block the AV node should be avoided, such as beta blockers, calcium channel blockers, digoxin, and amiodarone. Symptomatic clients are treated with atropine and transcutaneous pacing. There is no indication for a fluid bolus, cardioversion, or arterial line.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.